So we're going to put out an executive order today. New York State on pause, policies that assure uniform safety for everyone. Uniform safety for everyone. Why? Because what I do will affect you, and what you do will affect me. Talk about community and interconnection and interdependence. This is the very realistic embodiment of that. We need everyone to be safe, otherwise no one can be safe. We've studied all the other countries. We've talked to people all across the globe about what they did, what they've done, what worked, what doesn't work, and that has all informed this policy. Two basic rules. Only essential businesses will be functioning. People can work at home, God bless you, but only essential businesses can have workers commuting to the job or on the job. Second rule, remain indoors to the greatest extent to protect physical and mental health. On the businesses, on the valve, we reduced it to 50% of the workforce. We then reduced it to 75% of the workforce must stay home. And today we're bringing it to 100% of the workforce must stay home. These are non-essential services. Essential services have to continue to function. Grocery stores need food. Pharmacies need drugs. Your internet has to continue to work. The water has to turn on when you turn the faucet. So there are essential services that will continue to function, but 100% of the workforce. And when I talk about the most drastic action we can take, this is the most drastic action we can take. We also have specific rules for people's conduct. First is for the, what we call the quote-unquote vulnerable population. And remember, many people will get this disease. Different countries estimate 70, 80% of the population. People will get it. People will recover. That's what's going to happen for the vast majority. That's what's happening in this state for the vast majority. Who are we worried about? Seniors, compromised immune system, people with underlying illnesses. Where are the places we're really worried about? Nursing homes, senior congregate facilities. We need real diligence with vulnerable populations. And there's been a lot of confusion and a lot of different theories and a lot of mixed information. I've gone through it myself with my own family. As I said, we have my mother who lives alone. Everybody wants to help. And we've gone back and forth. Who should go visit mom? Should mom go to my sister's house? Should mom go to this house? Nobody knows for sure. I asked Commissioner Zucker, speak to every health official, get the best rules you can to protect our senior citizens and people with vulnerable populations, and that's what these rules are. Remain indoors, go outside for solitary exercise, pre-screen all visitors and aides. Don't visit households with multiple people. Don't go to your daughter's house. Mom doesn't want to be alone. I understand. But you bring her into your house, and you have 10 people there, and they're coming in and out, and your daughters have friends. That is a mistake. That is a mistake. Well, we're going to go visit mom. I'm going to bring the home family to see mom. No, not now. Vulnerable persons should wear a mask when in the company of others. To the greatest extent, everyone in the presence of a vulnerable person should wear a mask. They shouldn't be on public transportation unless it is urgent and absolutely necessary. Well, what does that mean? It means urgent and absolutely necessary. It means what the words say. I call it Matildas Law. My mother's name is Matilda. Everybody's mother, father, sister, friend in a vulnerable population. This is about protecting them. It's about protecting them. What you do is highly highly affects their health and well-being. The instinct to love, I want to be with them. I want my kids. Mom wants to see the kids. Be smart. My mother and your mother. For non-vulnerable populations, these are the rules. No non-essential gatherings. Any concentration of individuals is because you're an essential business and an essential workforce. When in public, social distancing at least 6 feet. Outdoor recreation is a solitary recreational exercise. It's running, it's hiking. It's not playing basketball with 5 other people. That's not what it is. It's not laying in a park with 10 other people and sharing a beer. That's not what this is. There are people and places in New York City where it looks like life as usual. No, this is not life as usual. And accept it and realize it and deal with it. Sick individuals should not leave their home unless they receive medical care, etc. Young people need to practice social distancing, avoid contact with vulnerable populations. Precaution, alcohol wipes. We talk a lot about hand sanitizer. Since I went into the hand sanitizer business, I'm a semi-expert on hand sanitizer. Hand sanitizer is alcohol. That's what it is. You can't get hand sanitizer, get a bottle of alcohol, pour it on wipes, paper towels. That's an alcohol wipe. Hand sanitizer now, according to the CDC, has to be over 60% alcohol to be effective. These provisions will be enforced. These are not helpful hints. This is not if you really want to be a great citizen. These are legal provisions. They will be enforced. There will be a civil fine and mandatory closure for any business that is not in compliance. Again, your actions can affect my health. That's where we are. So there is a social compact that we have. Government makes sure society is safe for everyone. What you do can affect my health. There's some bad information, especially among young people. You look at some of these videos that are going around and some of these newscasts on what young people are saying. I can't get it. Yeah, that's wrong. That is wrong. Well, young people can't get it. That is wrong. It's just not a factual statement. 20% of coronavirus cases, according to CDC, ages 20 to 44. Okay? France, more than 50% of the coronavirus patients in ICU under 60 years old. You can get it. Well, I can't transmit it if I'm not symptomatic. No, you can transmit it if you're not symptomatic. Even if you're young and strong and everybody's Superman, Superwoman, I can deal with it. Oh, yeah? You can give it to your grandparent, you can give it to your parent, and you can put somebody else's life in danger. Just factually, a lot of these premises are wrong. These are nothing that people don't know. It's nothing that we haven't been talking about, but we have to do it. And we have to be serious. And again, it is a government responsibility. Everyone has personal freedom, everyone has personal liberty, and we respect that, and I'll always protect that. But everybody also has a responsibility to everyone else. And this is a specific case of that. I believe in regional actions. None of these policies work unless the geographic area is an area that works. I have spoken to the governor of New Jersey, governor of Connecticut about the actions that we're taking today. I'm going to speak with them later this afternoon. We have been coordinating to the greatest extent possible, and they're going to be considering these policies, which again are very dramatic. And I said I'd like to do it in coordination. I understand we have somewhat of a different circumstance in New York, but they are considering it. We've added Pennsylvania and Delaware to the states we're working with. And again, you can have businesses in New Jersey. If they don't close, then their workers are driving into New York. Businesses in Connecticut stay open. You need New Yorkers to drive up to those businesses. So regional action is the best. We're talking. I'll speak with them later today.